If you're new to Medicare or will be in 2024 and you're wondering how much Medicare is going to cost you, this video is for you. Stay tuned. So a lot of people wrongly assume that Medicare is free. And the reason is because there's a lot of misinformation out there politically, in the media, all over the place, social media. There are so many people today who are surprised or even shocked when they find out that no, Medicare is not free. And so today we're going to look at some of the costs for Medicare so that if you are getting ready to enroll in Medicare, you can begin to budget and know what to expect as far as your health insurance goes. So if you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent. I started this YouTube channel to help people understand how the Medicare program works, again, because there's so much misinformation out there. So if you're interested in content around Medicare, make sure you subscribe to the channel. But I'm going to jump in and share my screen with you today. And we're going to dive in today and talk first and foremost about Medicare Part A. So Medicare Part A is known as your hospital insurance. And this was actually how Medicare started. It was started to help offset the cost for seniors when they go into the hospital. So most people in 2024 do not pay a monthly premium for Part A. So if you're eligible for Medicare and you can receive Medicare benefits, most people will not pay a monthly premium for Part A. However, there is a deductible, and this deductible is significant. So the deductible would happen if you were admitted into the hospital, and that deductible is $1,632. So as you can imagine, this is a significant cost if you are admitted to the hospital. The other thing to remember is this is not annually, this is based upon a benefit period. So there is no limit to the number of benefit periods you can have in 1 year. So let's say that you're admitted into the hospital in March, you spend a few days there, you're released, you're sent home, things are great. And then for some reason later on that summer, maybe in August, you're readmitted to the hospital. You could be exposed to that Part A deductible, again, high probability. So this is where the value comes in for a Medicare supplement plan. This is why people purchase a Medicare supplement plan G, a Medicare supplement plan N. This is one of the primary reasons, is to help offset some of these costs. So again, just to recap, Part A typically does not have a monthly premium, but there is a deductible. Okay, let's talk about Part B. By the way, I'll put a link to this page in the description of this video so you can look at it yourself, because it does cover co-payments for inpatient hospital stays, skilled nursing care, and some of those additional things. I'm not going to cover that in today's video. I just want to give a general big picture view when you're first eligible for Medicare. So check the description of this video if you want to read this page. Okay, let's talk about Part B. So Part B is known as your medical insurance. So this covers things that happen at your doctor's office, a clinic, basically outpatient services. So for most people in 2024, their premium for Part B, and yes, this is a monthly premium, is $174.70 a month. Now this can be higher if your income is higher, so it depends on your income. Also, it's worth mentioning that this amount can change each year. You'll pay the premium each month, even if you don't get any Part B covered services. So this is a monthly premium to have this coverage. And it's important to remember that you need to have this whether or not you choose a supplement or an advantage plan. I'm not going to go into those today. There's plenty of other videos out there on my channel and YouTube in general. But just remember that when you're new to Medicare, and you sign up, you're going to have to pay $174.70 a month. One thing I will mention is that if you are going to also be taking Social Security when you're Medicare eligible, that the Part B premium can be deducted from your benefit, and that way it's just paid. If you're going to delay enrolling in Social Security, then you can set up a payment plan for that $174.70 a month. All right, so let's continue on. So Part B also has a deductible. That is $240. Now that is for the year, and so you're going to want to make sure that you remember you'll have to meet that deductible if you start to have services. And again, you'll pay the $174.70 a month, and it has the $240 deductible. Also, I want to just draw your attention right here. It says general cost for services. This is called coinsurance. So Medicare does not cover 100%. There is 20% that comes to you for Medicare covered services or items after you've paid your deductible, as long as your doctor or healthcare provider accepts Medicare approved full payment. So again, you can see where there's some confusion about the cost of Medicare. Not only is it not free, Part B has a monthly premium, Part A has a deductible, and there's a 20% potential co-insurance depending on the services that you use. So as you can see, this can start to add up pretty quickly. All right, I'm going to scroll down just a little bit more. Again, this goes into some more details, but let's talk about Medicare Advantage plans. So if you decide to do a Medicare Advantage plan, what happens is you agree to have all of your Medicare under one private health insurance plan. Now, I'm not going to be able to be specific today in costs when it comes to Medicare Advantage plans. And the reason why is, as you can see, they vary greatly. So Medicare Advantage plan costs, premium and other costs like deductibles, co-payments, and co-insurance varies by plan, and also these amounts can change each year. Again, it just reminds you, you have to have Part B and keep paying your Part B premium to stay in your plan. And again, this page will give you the opportunity to compare costs in your area. Also, the out-of-pocket limit, again, this varies by plan. Once you pay the plan's limit, the plan pays 100% of your covered health services for the rest of the year. So we can't go into detail in this video, but again, on that page, it allows you to look at plans for Medicare Advantage right there on your page. And I can also help you with that as well. All right, so let's talk about Medicare supplement plans. So just by way of reminder, you can either do original Medicare or you can do a Medicare Advantage plan. So I'm not going to go into details and the difference of these. What I want to do is just, again, because I want to keep this video about cost, highlight a couple things. So under original Medicare, just by way of reminder, you usually pay 20% of the Medicare approved amount after you meet the deductible. And again, you can get a supplement to cover with that. With Medicare Advantage, the out-of-pocket costs vary. Plans may have lower or higher out-of-pocket costs for certain services. You may also have an additional premium. And when they say additional premium, what they mean is on top of your Part B $174.70 a month. Okay, under original Medicare, you pay a premium. Again, Part B $174.70 for most people. If you choose to join a drug plan, you'll pay a separate premium for your Part D drug plan. And then under Medicare Advantage, you pay the monthly Part B premium and may also have to pay the plan's premium. Some plans may have a $0 premium and may also help pay all of or part of your Part B premium. Most plans, and this is where it's different than original Medicare, include Medicare drug coverage. Okay? Under original Medicare, there's no yearly limit on what you pay out of pocket unless, and here it is right on the screen, you have supplement coverage like Medicare supplement insurance. With Medicare Advantage, the plans have a yearly limit on what you pay out of pocket for services Medicare Part A and Part B cover. Once you reach your plan's limit, again, you'll pay nothing for services Part A and Part B covers for the rest of the year. With Original Medicare, you can choose to buy a Medigap, like Plan G or Plan N, to help pay your remaining out-of-pocket costs like 20% coinsurance, or you can use coverage from a former employer or a union or Medicaid. Obviously, with Medicaid, you'd have to be eligible. If you choose a Medicare Advantage plan, you cannot purchase a Medigap plan. So you have to choose one or the other. So again, I hope this video was helpful to you. If it was, please hit the like button. If you have specific questions about Medicare, you can certainly leave them in the comments below. Again, I'll leave a link to both of these pages in the description of this video so you can read them as well. If you would like any sort of no obligation help with your Medicare coverage, you can get in touch with me through my website. Again, it's just meetjamie.com. Thanks for watching. Have a great day. We'll see you in the next one.